The purpose of this program is to provide you with a better understanding of the medical diagnosis that was given to you or someone you know. This program does not provide specific medical advice. The information it contains should not be interpreted as a recommendation for a specific treatment plan or course of action, and cannot replace the advice of your own physician. What is right for any one person is an individual decision. You should consult with your doctor, who can discuss your needs, symptoms, and treatment. Our medical director, Dr. C. Everett Koop.
We can plan for and anticipate many things in life, but a health concern is usually not one of them. What I have learned over the years as a physician, as the Surgeon General of the United States, and as a patient, is that understanding a health problem can make a real difference. Over the next 30 minutes, we will take you through the very issues you are probably wondering about right now. By the end of our program, you will have the knowledge you need to better understand what you or a loved one is faced with and what can be done about it. No matter what challenges lie ahead, it helps to be knowledgeable and to stay informed. So stay with us, because we're going to help you do just that.
Hello, I'm Mike Schneider. Almost everyone has low back pain at one time or another. It's so common that only colds and flu send us to the doctor more often. It's hard to avoid low back pain altogether, but you can learn ways to reduce your pain and protect your back from further problems. Over the next 30 minutes, we'll show you what doctors know about the different causes of low back pain. We'll also explain why it's important for you to play an active role in the treatment of this common condition. Our program is made up of 4 reports. In Report 1, we look at what's going on inside the body and how doctors diagnose low back pain. In Report 2, we look at what happens next after the diagnosis, including which healthcare professionals you might encounter. Report 3 explores options for treatment and management. And finally, in Report 4, we address issues that frequently arise. We'll be giving you a lot of information. To review it, use the booklet that comes with this program. You'll also find a place to write down questions and take notes when you're with your doctor, and a list of other resources that are available. And now, our first report.
Report 1. Understanding the diagnosis.
I couldn't get in and out of a car. I couldn't pick up my underwear. I couldn't even pick up my nephews. I couldn't do the things that men are supposed to do every day. That's how bad the pain was, how severe it was.
It's just like if you have a toothache and it's always there, and then you have to deal with kids. I know it's like, it's a nightmare, really.
Low back problems can make your life miserable. The pain can be severe, and it often interferes with everyday activities like work or playing with your kids. Fortunately, most low back problems aren't serious, and the pain is almost always short-lived. Doctors say even without treatment, most people with low back pain recover within a week or 2 of their initial symptoms.
Improvement's going to happen, and it's going to happen quickly. Even if the pain is very severe, they may be so much better by a day or 2 later that it's just hard to imagine.
Most of us will have some low back pain during our lifetime, but it's most common in adults aged 35 to 50. Work that requires heavy lifting or twisting may put you at a greater risk of low back pain. But jobs that require long periods of sitting are just as stressful on the back.
30 or 40 years ago, we typified the individual with low back pain as a construction worker, as an automobile mechanic, but we've subsequently found out that even the so-called white-collar worker who sits at a computer terminal or at a desk or in front of the bookkeeping site all day is also at high risk for low back pain.
To better understand why low back pain occurs, let's take a closer look at the back itself. From the base of the brain, the spinal cord extends down to the lower back. Nerves run from the spinal cord throughout the body. They control muscles in the body, telling them when to contract and move. Nerves also carry messages like pain to the spinal cord and up to the brain. The spinal cord is protected by the spine, which supports the back. From the side, the curves of the spine are visible. The inward curve of the lower back is formed by the curve of the lumbar spine. A stacked column of bones called vertebrae make up the spine. Joints connect the vertebrae and help the spine move. Cushions called intervertebral discs are found in between the vertebrae. The discs act as shock absorbers for the spine. A closer look at a disc shows that its outside is rigid for support. The inside is a gel-like fluid which helps absorb pressure on the spine. A canal running through the vertebrae contains the spinal cord. Nerves branch off of the spinal cord and exit the canal through holes between the vertebrae. Our lower spine supports 70% of our body weight. That kind of stress takes its toll on the structures in the low back. When any one of these structures becomes injured, worn, or inflamed, pain can occur. Muscles and ligaments in the lower back can be overworked or stretched too far. When this occurs, it can set off a painful reaction, thought to be due to muscle spasms. Many doctors believe this is the most common cause of low back pain. Discs may also be a source of low back pain. Aging and stress on the spine can cause tearing in the outer rim of a disc. With the rim weakened, the disc may bulge. This is called a herniated disc. Sometimes a herniated disc presses against a nerve, causing symptoms. This is called a pinched nerve. Pinched nerves can also be caused by pieces of the rim breaking off, or in rare cases, by a rupture of the rim, allowing the gel-like contents to flow out. Several nerve roots at the end of the spinal cord join to form two large nerves called sciatic nerves. One runs down each leg. When the roots of the sciatic nerves are pinched by a disc, a mixture of pain, weakness, or numbness may be felt in the leg. Doctors call these symptoms sciatica.
When leg nerves are pinched, walking can be painful, as computer analyst Bonnie Townsend learned firsthand.
I noticed at work that I could walk maybe 30, 40 steps at the most, and the pain would just get so excruciating that I would just have to sit down.
Discs often herniate after years of wear and tear. Once a disc has been worn down, a seemingly trivial event can trigger the herniation.
The person who herniates a disc is somebody who is going to have that happen to them at some point in their life. Whether they were bending down to tie their shoe, or they were going to throw out the trash, or they were moving an object at work. That was an accident waiting to happen.
Changes in the vertebrae and their joints can also cause low back pain. These changes can be caused by aging or injury. In very rare cases, low back pain has a medical cause, like a tumor or infection. Symptoms that may point to a medical cause include unexplained weight loss, fever or chills, and pain that isn't relieved by bed rest. But doctors stress that most low back pain isn't a sign of a serious medical problem.
In our history and our physical exam, we can rule out those serious conditions to the point where we can really tell patients with a clear conscience that the good news is that there's no hint of anything really bad going on.
Ready to go?
Yeah.
Doctors can learn a lot about a back problem by asking questions about your symptoms. A physical exam also points to possible causes for your pain.
Two important parts of an examination are determining whether or not the patient is able to move and to what extent he can move, and as a piece of that information, what movements cause pain. You're not having any pain down into your foot?
Not right now, but it does.
That gives information as to what parts of the spine might be responsible for the pain.
Unless a bone fracture or some other serious disorder is suspected, most doctors won't order x-rays or other imaging tests during an initial exam. Pictures of the spine seldom show what's actually causing low back pain.
There are these many anatomical structures in the low back, nerves, ligaments, muscles, as well as bones and discs, that they don't all show up well on any of the imaging tests that we have, and that therefore it may be impossible to know exactly which one of them is the source of pain in a particular circumstance.
Doctors can't always say with certainty why your back hurts, but they do know that you're likely to get better soon, regardless of the source of your pain.
Oh, that's much better.
Much better? Okay.
We know that most patients are going to improve, that this is a spontaneously resolving disorder, and having a patient go through multiple tests to come up with a definitive diagnosis is not going to change how we treat those patients anyway.
Once it's been determined what may be causing your back problem, treatment can begin. But how do you decide which healthcare professional to seek treatment from? We'll explore that question in our next report.
Report 2. What happens next?
The severity of your condition and your overall health will determine what happens next after the diagnosis. The truth is, some things in your day-to-day life may change. You will need to take personal responsibility for scheduling doctor's appointments or remembering treatment plans, and you will want to know what may lie ahead for you.
There's quite a range of professionals who treat low back pain. Besides medical doctors, there are chiropractors, physical therapists, occupational therapists, the list goes on and on. In most cases, specialized care is unnecessary. A primary care doctor can usually diagnose and treat your pain, and if needed, refer you to other healthcare practitioners.
I think navigating through that maze of specialists and practitioners of various sorts really should be, in most cases, the job of a primary care physician, a family doctor or an internist who is, if you will, the director of the orchestra and should be helping to coordinate things and making sure that things happen in some logical, rational sequence.
Welcome to the back school.
Some doctors refer their patients to physical therapists, many of whom teach specialized classes called back schools.
What I'm going to try to teach you today are just some preventative measures.
These classes teach people with low back pain how to safely resume normal activities.
We'll teach you how to avoid problems by showing you how to sit correctly, how to get out of your car if you're having a problem, how to bend correctly, how to lift, how to get things out of your trunk, how to mop your floor. A lot of things that we take for granted.
But instead of bending like this and having his hands in, he's tucked in.
Learning safe ways to lift and bend are important for postal worker John Murphy. He hurt his back lifting mail trays.
That's right, so you got a nice inner curve there.
I was twisting and putting the tray on the rollers. When I came back around, I felt a twinge in my back. It wasn't painful, but it started getting a little bit stiff. And the next day there was a little bit of pain. And about a week went by, and all of a sudden it became extreme pain where I couldn't stand, I couldn't sit.
Now keep your back inward, and now tilt at the pelvis.
Until John's back is stronger, he'll have to avoid the twisting motion that caused his pain. People with severe low back pain may also need to avoid heavy lifting, bending, or reaching. Prolonged standing or sitting can also aggravate low back symptoms.
Generally, when anybody is doing anything for a long period of time, I would advise them to change the posture. If you're sitting and you're in a bent position, I like to see you stand up and maybe do a gentle backward bend to take the forces away that you had when you're sitting.
Go like this and go nice and easy. Okay, just ease back.
Hi, Brian. Michael Hurley from Century Associates. I just want to give you a brief call to see if you received the resumes I sent you.
Sitting all day is sometimes painful for headhunter Michael Hurley. He periodically readjusts his posture to minimize low back problems.
Okay. Being a headhunter, I'm on the phone most of the day. You tend to start to move sideways. You're leaning over to do paperwork, to write notes down to yourself. So the way that I try to cope with that is to get up every 15, 20 minutes, to stretch, go to the water cooler, go to the bathroom, just stretch and get back into that neutral position again where you're more comfortable.
Placing a small pillow in your chair may also make sitting more comfortable. Doctors say a little discomfort shouldn't keep you from resuming many of your regular activities. In fact, becoming active again may make you feel better faster. More about that in our next report.
Report 3. Treatment and management.
Your doctor will advise you on what treatment or management approach is recommended for you. It is important that once you have decided on a strategy with your doctor, that you do your best to stick to it. Make sure to take notes on how your treatment seems to be working for you, and let your doctor know how you feel about your progress.
Most patients get well over a period of time, even if they don't do anything for their lower back. So the role of getting treatment is to speed the process of recovery, to reduce the amount of pain that they are having, and to increase their ability to function while their body heals.
The treatment of low back pain is a subject of some debate in the medical community. Healthcare professionals differ on which treatments are the most effective for relieving back pain. There's widespread agreement, however, that movement is good for the back and may help to speed the healing process. Generally speaking, the faster you're on your feet, the more quickly you'll recover. Initially, bed rest may relieve your pain and keep you from aggravating your back problem. But studies show that more than 2 days in bed can be counterproductive.
We lose muscle strength very quickly. We lose heart and lung conditioning very quickly. We actually begin to lose calcium from the bones very quickly while you're lying in bed. And we've come to realize that it may do as much harm as it does good.
When somebody injures their back, we want them to be moving as quickly as possible. There's a general rule of thumb that if you don't use it, you lose it. And that is applicable to the individual who has low back pain.
Of course, moving isn't easy when you're in pain. That's where medications and other therapies may help. Keep in mind that treatments for your pain don't heal your back. What they can do, however, is make pain more tolerable so you can begin to resume some of your daily routine. Ice packs and heating pads applied to the site of your pain may make your back feel better, but they don't help all patients, and the relief isn't long-lasting.
I counsel patients that it's inexpensive and easy to use a heating pad or a hot water bottle that they have at home, or make an ice pack at home and give it a try. And if that gives them some relief, then I'm not going to argue with success.
Non-steroidal anti-inflammatory drugs, or NSAIDs, provide effective relief for many people with low back pain. Over-the-counter drugs that help reduce inflammation are aspirin, ibuprofen, and naproxen. Other NSAIDs are available by prescription. Most people can use NSAIDs safely, but it's a good idea to read the warning labels on any medicine. Don't exceed the recommended dosage, and ask your doctor or pharmacist about possible side effects.
The main reaction that one has to worry about is inflammation of the stomach lining or damage to the stomach lining, sort of called ulcerations of the stomach. And you can get bleeding, and that can be severe, particularly in older people or people taking a lot of medications or who have ulcer disease.
Acetaminophen is another effective pain reliever. Although it doesn't reduce inflammation, it has fewer potential side effects than NSAIDs. For severe low back pain, some doctors will prescribe muscle relaxants or narcotic medications, such as codeine. These types of drugs can impair your judgment and make you drowsy. Narcotic medicines can also be addictive and should never be used for long-term pain control.
Spinal manipulation is another type of treatment for low back pain.
Any pain right now?
This brand of therapy requires a trained professional who applies pressure to the spine.
We don't fully understand everything that happens during spinal manipulation. What we do know is that when you have limitation of motion associated with pain, and you introduce a normal, appropriate motion through loading or putting forces into the spine, that you can immediately reduce the relative amount of pain and increase their function.
Spinal manipulation is typically performed by a chiropractor or osteopath.
Let's take a deep breath and exhale. Very good. There we go.
Not all medical doctors approve of this treatment, and it's not recommended for patients with leg pain. But studies have shown that spinal manipulation often helps relieve low back pain, especially in the first few weeks after pain occurs. There are many other treatments for low back pain, but medical researchers say most therapies haven't proven effective for the majority of patients. Still, some people do get relief from other treatments, ranging from massages to acupuncture. Exercise can help you recover from a low back problem and perhaps avoid future problems. Your doctor can recommend exercises that are safe and can be done with a minimum of discomfort.
We often suggest just walking for starters, because being upright is usually more comfortable than sitting, and most patients can walk fairly easily without causing too much discomfort, and it's a good way to get started.
Once the worst of your pain has subsided, exercises to strengthen your back and abdominal muscles can be added to your routine.
After the first couple of weeks, it's very important to get the patient on a specific program aimed directly at their back to increase range of motion and to keep their muscles from losing tone and losing strength.
Carpenter Joe Lowachi is on the mend from a painful disc herniation. He was skeptical when his doctor prescribed a program of walking and back strengthening exercises.
I thought, exercise, I'm 46 years old. Last thing I need is exercise, I haven't did this since high school or something.
The exercises were hard at first, but Joe stuck with the program. Now he has greater flexibility and is living without pain.
This exercise program was like somebody turning on a light switch. It's the difference between night and day. I could chase my little girl around the house and play with her and just 100% feeling better.
Most people with low back pain can return to work in a few days and fully recover within a month of starting treatment. But if your back pain persists or worsens, you should return to your doctor for reevaluation. Imaging tests may be appropriate for patients who haven't responded to treatment. If those tests reveal a disc pressing on a nerve, which is causing persistent back and leg symptoms, then surgery may have to be considered. About 1% of patients with low back pain opt for surgery.
Surgery is an appropriate option for the individual who has back and leg pain, and they have not improved with appropriate non-operative care.
Surgery doesn't make the back stronger, nor is it a guarantee against future back pain. In many cases, the goal of surgery is to speed the healing process and to prevent permanent nerve damage.
We know that after years elapse, after 5 or 10 years, people will do much the same with or without surgery, but the surgery does give faster pain relief early on for those patients with a pinched nerve who haven't responded to non-surgical treatment. And again, this is a very, very small minority of patients who have back problems.
Bonnie Townsend is one of those patients. After months of severe leg pain, she opted for surgery to remove part of her herniated disc.
I feel like with all the research that I did that this was the only option for me. I don't feel like I could have done it any sooner. I had to have it right with me before I made this decision.
Fortunately, the decision about whether to have surgery is one that most people never have to face. 9 out of 10 patients with low back pain recover within 6 weeks of their initial symptoms.
Report 4. Issues and answers.
By asking questions and discussing things, you give your doctor a better understanding of your specific concerns, and that's important. Do not hesitate to ask questions. In fact, it might help to write them down beforehand. You are not the first person in your situation to have those questions, and you won't be the last.
What I did, I walked into the doctor's office with a long list of questions. I just had to have some answers to my questions so that I could feel more comfortable.
At the time of diagnosis, people do have an awful lot of questions that they want to ask. And here to talk about the issues and answer some of the questions is Dr. Augustus White III, Professor of Orthopedic Surgery at Harvard Medical School. Doctor, good to have you with us.
It's good to be here. Thank you.
Let's address some of the things we just heard from that patient there. What to ask and how to ask the doctor questions? It seems so difficult at times. What kind of advice can you give us?
I think there are two major things. First of all, it's good to think through your questions, the major things that you're really concerned about, so that way you can focus and you can ask the questions clearly. And it's good to write them down, as has been suggested. That way you, of course, will remember all the things that you want to ask. It's natural to be nervous and think about things when you're in the doctor's office and sometimes not really remember everything that's been said. A good way to remedy that is to bring in a friend, a spouse, a significant other, whatever, to maybe take notes and sort of listen to the doctor, and then you can discuss it later.
Now, you're a surgeon, so let's talk about surgery in this regard. Tell us about what is done in surgery and when surgery is really necessary.
Well, surgery is necessary when the patient has had a reasonable opportunity to get better, 4 to 6 weeks at least, to get better, and some good non-surgical treatment. And when there is something that is surgically correctable. We talk about something that you know that you can go in, you can see, and you know that you can change it. Most commonly, this is a herniated disc. And what is done under general anesthesia, a careful dissection is done down to the area where the disc is herniated, and then the technique is carried out, preferably by someone who has special training and special expertise in spine surgery.
Let's talk about people with chronic pain, pain that just doesn't seem to go away. What are their options?
Chronic pain. First of all, I think there are two things to be aware of to avoid. One is not to allow yourself to get hooked on addicting drugs, narcotics. Then you have two problems. You have a chronic pain problem and you have a drug problem. So we want to try to avoid that. And then the other thing is not to have surgery without a second opinion for chronic pain. So within those broad parameters, I think those are some don'ts to be concerned about. Now within that spectrum, there are 2 or 3 things you can do. One is a pain management clinic. Some of these are outpatient, some are inpatient. That's one important option that's available. Another is to just put yourself on a rigorous exercise program, swimming, walking, or stationary bicycling. And a lot of times this will break the patients out of a chronic pain pattern and they will be better.
There's some products out there, I'm sure you've seen the ads for the pillows or special beds that seem to say that they can help people with low back pain. Are there any of those products out there that seem to be effective in helping to avoid or treat low back pain?
In general, a firm mattress is preferable. Now there are exceptions. If a patient is comfortable and has a particular mattress that they like for whatever reason, I would not discourage them from using that. But in general, a firm mattress. A waterbed is sort of neutral, and a soft mattress may be less therapeutic and less effective for patients with back pain. So I generally advise patients not to use a soft mattress and to lean toward a firm mattress. Another little trick you can do is actually put 3 or 4 blankets on the floor and sleep on the floor for 1 or 2 nights. And if things feel a lot better, then it makes sense to invest in a really firm mattress.
Some people say that when they try to exercise after having low back pain, that it hurts again. Are these people re-injuring their backs? Should they avoid exercise?
Usually they're not re-injuring. They're aggravating it. And it's a judgment call. I encourage my patients to exercise into the range of pain to a reasonable extent, not to make themselves miserable and uncomfortable for the next day or 2 or even the whole remainder of the day they're exercising. But I reassure them that it's okay to exercise with a little bit of pain.
So, doctor, if you had to encapsulate into one strong, short message what people with low back pain need to know, what would you say to them?
First of all, you're going to get better. And while you're getting better, there are lots of opportunities for help in terms of support during that process. Education is very crucial in survival and quality of life in patients with back pain. Once you understand something about the disease process, something about what your options are, you can then use your own common sense
and your own ingenuity to really work around the problem until indeed it does get better.
Thank you for joining us, Dr. White.
Thank you.
And thank you for joining us. Remember, you can use the booklet that came with this program to review key points and to take notes. You'll also find a resource guide and a glossary of terms that may be helpful. That concludes our series of reports on low back pain. We wish you well.
I hope we have done our job and that you are better informed. The knowledge you have gained should help prepare you for decisions you may have to make. It can also help you sort out any additional information you receive, whether it is from well-meaning friends or the evening news. Facing what you or a loved one is going through right now involves taking personal responsibility. Responsibility for keeping in touch with your doctor and other health professionals and for following their instructions. And of course, responsibility for getting the support you need to cope with certain issues. For all of us with Time Life Medical, thank you for turning to us at this time in your life.
To help you access important information that was covered in this program, you may refer to your personal workbook. You may also find additional information related to your situation in other Time Life Medical videos.